Hi, I'm Ben Hirschenfang. I'm a consultant with Global Public Health Services and former aerospace engineer, program director. And today I'm talking with George Vaughan. George, can you please introduce yourself?
Yes, good morning. My name is George Vaughan, and my background is public health, in particular, disease control and epidemiology. I'm a retired public health officer from the Commissioned Corps U.S. Public Health Service.
So we have an epidemiologist talking with an engineer. This should be interesting. So we're going to talk today about the impact of COVID-19 on the cruise industry. So I have a few questions for you, George. If you can answer this, I really would appreciate it.
Sure.
First one is, can you discuss the origins and evolutions of the CDC's framework for conditional sailing for return to sailing for the cruise line industries?
Sure. The CDC framework for Conditional Sailing Order, or CSO, sometimes called a framework as well, was implemented following the no-sail orders that went into effect on 14 March of 2020, which also had 3 subsequent extensions and modifications. The no-sail orders actually expired on 30 October of the same year, and the CSO went into effect on the same day. The purpose of the framework, or CSO, is to assist the cruise industry in its safe return to cruise operations within the United States. The CSO uses a 4-phased approach, which includes a series of activities with the idea of bringing safe operations to cruise ships within the United States. The first phase, or phase 1, involves mass testing, and usually that's through nucleic acid amplification tests or antigen testing, along with the laboratory capacity building, including onboard testing capabilities on cruise ships. Phase 2 involves voyage preparation, including screening, testing, a 14-day quarantine requirement for a newly embarking crew, the development of port, medical, and housing agreements that are approved by the port and local health authorities. Phase 2B has specific requirements for a simulated or trial voyage, including approvals to conduct those simulated voyages and requirements for after-action reporting. Phase 3 of the CSO involves procedures for the issuance of conditional sailing certificates, which indicates cruise ships have met CDC's public health standards. And finally, phase 4 outlines restricted passenger voyages, which include resumption of passenger operations with shortened voyage lengths as well as testing requirements. The guidelines for compliance at each phase of the CSO is provided through a series of technical instructions and supporting documents, which were published at different intervals based on the evolving science under the pandemic conditions. The CSO remains in effect until the 1st of November of this year, or if it's rescinded by the CSO director.
And what's the current status of the framework, and what are some of the challenges for implementation of the framework?
Well, to my knowledge, all aspects of the framework have been outlined in technical instructions by the CDC. They're pretty detailed, and I'm sure there's going to be some challenges in the implementation of the framework. Some of the ones that I think that may be challenging include the enforcement of passengers' compliance with the mask mandate, which is required on cruise ships, as well as other conveyances, and as well as in transportation hubs, including cruise terminals. Similarly, I think the enforcement of physical distancing requirements that are also under the CSO in some areas, public areas specifically of the cruise ship, such as buffets, a pool deck comes to mind, and indoor entertainment areas of the ship, such as theaters and clubs, could tend to be a challenge for enforcing those particular social and physical distancing requirements. I think in addition, in the crew spaces, crew areas, since they tend to be small, and constitute congregate living in social spaces, that social distancing or physical distancing requirements could be a challenge there as well. I think managing the inevitable SARS-CoV-2 outbreaks and the initial contact tracing efforts that are also required under the framework may present some challenges for the cruise ship operators as well. And then finally, I think that consistently maintaining the recommended vaccination levels when they are ultimately published and other public health interventions to prevent outbreaks could be of a challenge. This will be particularly challenging, in my opinion, with the proliferation of the SARS-CoV-2 variants that may impact vaccine efficacy.
How do the variants play into any possible impacts to the framework and operations of the cruise lines?
Well, I think that the variants will have a significant impact on, or potentially have a significant impact on vaccine efficacy. Now, we have several very good vaccines that are available, and the cruise industry was pretty excited about the fact that the vaccines were available. Now, in terms of the CSO requirements, recall that if a cruise ship operator can attest to 95% vaccination status within both the passengers and the crew, they can forego certain phases of the framework and proceed to the final phase, phase 4, which is where they conduct more robust sailing, although albeit it's somewhat reduced in terms of normal sailing activities. However, the variants can really impact the efficacy of the vaccines, or at least has the potential to do so. And in that case, my concern would be if it reduces the efficacy of the vaccines to a certain level, then that puts the cruise ship at risk of outbreaks potentially. So I think it's an important aspect to follow and to consider, and particularly with the potential for breakthrough infections and so forth for those that are vaccinated with the current vaccines. So it may require in the future also that a booster be administered. So operationally, that would require the cruise line operators to provide boosters to their crew. And so operationally, that could impact them.
And especially since they'd have to consider their ports of call and what that country's requirements are for acceptable vaccines.
That's true. Exactly. Mm-hmm.
Well, that leads me to the next question is, how do vaccinated versus unvaccinated passengers play into the framework?
The latest CDC recommendations, as I understand it, under phase 2B of the framework, is that if a cruise ship operator can attest to 95% vaccination rates within both the passenger and the crew populations, then the cruise ship operator can actually forego the simulated voyages under phase 2B and proceed directly to the restricted passenger voyages under phase 4. That would be to the cruise ship operator's advantage. Obviously, there are less hurdles that they have to, bypass in order to get back to full operations under the CSO framework. There may be challenges in reaching and maintaining that 95% vaccination standard in the crew, I think, particularly if the expectation is that the cruise ship operators is to vaccinate cruise members in their countries of origins, since vaccines are not as plentiful outside of large countries. Information on vaccination status. For example, the governor of Florida has a lawsuit pending against the CDC regarding requesting that information on vaccination status, the so-called vaccine passport issue. This could hamper the cruise line's ability to properly identify those who are fully vaccinated. There's also a recent development where some cruise ship operators are not accepting mixed vaccinations with AstraZeneca vaccine with the mRNA vaccines. This is a practice that, while not something that's done in the United States, has been done in other countries and is an accepted standard, such as in Canada. However, is not accepted here in the United States. So that may present some problems in reaching that level. Also, these issues, I think, could potentially impact the cruise ship operators' ability to comply with the CSO framework.